Thank you very much. First of all, I would like to thank the organizers of this conference for their kind invitation to me to speak today. I'm really pleased to be able to speak to all of you in the audience, as well as the esteemed members of our jury. Before I begin, two disclaimers. Contrary to the program, I will not be speaking specifically to data in terms of incidence and prevalence of AROs in Canada. I'll be leaving that to a fellow speaker who'll be presenting later this morning. And the second disclaimer, as you can see from my presentation, is that I'm supposed to bring Canadian perspectives, and certainly in 15 minutes I don't think I can do justice to all the various Canadian perspectives. So I will be focusing exclusively on the federal government perspective here in Canada, and more specifically the Public Health Agency of Canada. Just a couple of points in terms of, I think, are important for all of us to consider in terms of our discussions over the next few days and moving forward. As Dr. Ramon Pardo eloquently put it, certainly AMR is a global threat, and I think we recognize that in Canada. It's also very complex, and we recognize to be able to address this appropriately, we'll need the collaboration of multiple players across multiple sectors. The other part also, I think, is that with globalization, we recognize that we're also interdependent. And with travel, for example, including medical tourism, and trade, including export-import of foods across the world, what happens in one country or doesn't happen in terms of addressing AMR appropriately will have implications for the rest of the world. The second point in terms of the morbidity mortality, I don't think I need to say to this room how important that is in terms of what happens in the hospitals, but I'd like to draw your attention really to the last sort of sub-point under that bullet. And as I move forward, and certainly in the work that I do, I recognize that as we bring this up to decision makers in higher levels, the political level obviously is very important, that the economic aspects will become more and more important in terms of our conversations moving forward. So those types of arguments in terms of being able to characterize, for example, the costs. For example, I understand $42 to $59 million is sort of the estimate for the cost of isolation and dealing with MRSA in hospital settings, as well as, let's say, the impact on the Canadian economy being well over, let's say, $800 million in terms of healthcare costs alone. So those economic aspects will be important as we move forward on this very important issue. Third point already made, I think is concerning certainly to me, but I think for all of you as well, is the fact that new antibiotics in terms of what's in the development pipeline is certainly decreased compared to years ago. And certainly I think one of our challenges that we need to address moving forward is how do we create the infrastructures, the environment that facilitates and encourages innovation and research for new antibiotics and so on. And then finally, I think, sort of the doomsday scenario that all of us understand is really at play is that if the status quo continues, certainly we are at risk of returning to what we call the pre-antibiotic era. So that's something that I think we all need to keep in mind. This slide, I think, was already alluded to by Dr. Talbot, and certainly I think will come up again and again, is that I think most of the focus for this conference will be on sort of the human health, what happens in our healthcare institutions and the right to measures and surveillance and screening and what we need to do. But at a broader level, we all recognize that in sort of the One Health approach, that we're interdependent, and what happens in the human health sector obviously is also connected to what happens in the animal health sector and agricultural practices, as well as the environment. And you can see all the drivers up there, and of course our favorite list of bugs down the side, on the right-hand side. And so this is really the bulk of my talk today in terms of, from a federal government perspective, or the Public Health Agency of Canada, what we see as our key business lines. Sort of very simply, I'll speak to each of those, and what we believe are sort of our value added in terms of our specific role and what we bring to the table, so to speak, to hopefully complement and support our many partners and stakeholders out there. So I'll speak to each of them in turn. In terms of surveillance, I think, as they say, it's a no-brainer. Everyone here in this room appreciates that surveillance is the key. It's the foundation, it's the data that characterizes the extent of the problem. Then hopefully we do the right sort of programmatic changes or activities to address it. It's hopefully also a way of monitoring that we are making progress. From the agency perspective, we're very proud of two specific surveillance programs that we undertake, and obviously in collaboration with our partners. One is affectionately known as CNIS, the acronym standing for the Canadian Nosocomial Infection Surveillance Program, and that's a partnership with our friends in AMI. And you can see it's a long-standing program that's been in place since 1995. And the other one is known as CIPARS, or the Canadian Integrated Program for Antimicrobial Resistant Surveillance, and that's also long-standing, being in place since 2002. I won't get into all the details about the number of participating sites and provinces, et cetera, you'll learn that in due course. But I think that the bottom point for each of those surveillance systems is that we recognize the main purpose is to provide the benchmark data that will obviously be of use to frontline practitioners as well as to policy and program decision makers. So that really is the key objective of each of these surveillance systems. Having said that, we recognize, is our surveillance perfect, even within the agency and throughout Canada? Of course not. There's so much more we could or should do. And I can tell you right now that within the agency, we have struck an internal work group to look at what we're doing now and what we can do better in the future, as well as with our PT partners, that stands for Provincial Territorial for out-of-country guests, in terms of what we can also do in the federated state that is Canada. This slide, I think, is just to illustrate that data is key, and I apologize for the acronyms under the CNIS program. These are examples of some of the, quote, bugs we are tracking. For example, HACDI stands for Healthcare Associated Clostridium difficile. There's MRSA for methicillin-resistant Staphylococcus aureus, VRE for vancomycin-resistant enterococci, and the CPO for the carbapenemase-producing organisms. And what's interesting is that, of course, Canada being a large country, there are variations across the country between the different organisms where there are higher rates in certain parts, be the center versus east and west. And I think it's part of our collective job to understand why, to look at the factors, and then see if there are things that we can address both locally in individual hospitals, regions, but also across the country as a whole. This next slide, I think I just want to highlight that one of the things that we're looking at is what we call AMU, or antimicrobial utilization. And I think that's very important because I think most of the focus, or at least a large part of it to date, has been focused on the bugs, sort of, tracking the bad bugs in hospitals and so on. But we're recognizing that utilization data in terms of our surveillance activities will also be very important in the future, and that's something we could or should enhance. So in many ways, it's really two parts of the house. We need to keep focusing on sort of the bad outcomes, the resistant organisms, but also looking upstream in terms of the utilization and hopefully seeing a change in terms of what we call prudent utilization of antimicrobials. And then here, I think, is a good example of hopefully is something that will be happening more and more in the future, and that's how surveillance data can inform policy, and then hopefully you can see an actual change. And this one is data coming out of the CIPARS program, where based on sort of, you look at the two lines, one is tracking sort of the prevalence of drug resistance for one of the cephalosporins in both retail chicken in the poultry industry and also in humans, and you can see it was quite high early in 2003. Then based on that data, the industry actually did a voluntary withdrawal of the use of that antibiotic. And you can see the rates both in the chicken, the retail chicken, and in humans went down. And then when there was a partial return to use, the rates went back up. So that's a kind of, I think, use of surveillance data that we can maybe foresee hopefully happening more and more in the future as we move forward. Next area where I think the agency has an important role to play, obviously, with all of you and others throughout the country, is in the area of what I call KTE, or Knowledge Translation and Exchange. And really what I'd like to highlight is that there are really sort of two main audiences or key populations. One is the general public, and I think many of you in this room will recognize that despite our best efforts, that there's still, I think, a lot of misunderstandings, misperceptions, whatever you want to call it, in the general population about the appropriate use of antimicrobials and antibiotics, et cetera. And so I know there's been lots of good campaigns, activities in the last few years, but it's one of those things where you just have to keep at it, and you can't just sort of say it's a one-time thing and that's over and done with. It's something that needs to be continually reinforced and ongoing. And certainly where we continue to work with our partners. And I would like to point you to Antibiotic Awareness Week, which is something we're working towards, which is recognized globally and takes place every year in November. And of course, the other key audience is what we call the professionals. And we're very pleased that we are able to work with many of the experts across the country and internationally to develop what we call guidance, both for public health practitioners, but also for healthcare practitioners and others in terms of informing what we call the responsible use of antimicrobials and infection control. And certainly we're very keen on the fact that they're always evidence-based, And the fact is that they're always used as, I think, a foundation or a baseline, recognizing that individual provinces and territories are always free and certainly can modify to their own context. And they're never meant to supplant what individual provinces and territories do. And so here's just an example, a list of some of the guidance that we've put out in the last few years, going from the very, very generic, such as routine practices and additional precautions for preventing the transmission of infection in healthcare settings, to more specific ones focused on specific bugs like C. difficile. This one I think I'd like to focus a little bit more on, and I think that's why many of the stakeholders and partners out there really focus on the agency, because recognizing we do have a unique role to play in terms of partnerships, and the fact that we're in a unique position to optimize partnerships with many of the key AMR stakeholders. Internationally, we have good, obviously, working relationships with multilateral organizations like the WHO and PAHO, as well as bilateral with organizations like the CDC in the US and the European Center for Disease Control. So that's an important aspect, because we recognize moving forward, we're not going to be able to do it on our own in terms of addressing AMR. Within the federal family, lots of other departments we recognize we need to work with closely, including Health Canada, which has an important regulatory role, as well as CFIA, Canadian Food Inspection Agency, because of the food and antimicrobial aspects there, as well as CIHR, which is the lead for the federal government in terms of research. CIHR standing for Canadian Institutes for Health Research. Next one I'll focus a little bit more as well is the provinces and territories, and something called the Public Health Network, which I'll get to on the next slide. And as well as we recognize is that we need to work with our partners, both NGOs, professional organizations, and other stakeholders out there. And so I just draw your attention to this wonderful map of Canada, because I think it speaks to the fact, a recognition that in Canada, we are a federated state. And so in essence, we really have 13 sort of individual sort of healthcare and public health systems recognizing the responsibility of the provinces and territories. 14 if you include the federal government for our responsibility, for example, populations like First Nations, people on reserve. We have the Public Health Network, headed by Council, which reports to Deputy Ministers, but we recognize that the federal government can't do it alone. And so we really count on the good collaboration and goodwill and a commitment by our provinces and territories to work with us in that regard. In terms of laboratory services, we're very, very proud of our National Microbiology Laboratory, which, as you can see here, has a range of services we offer to our partners, the provinces and territories, in terms of reference services, technical support, and so on. One of the issues we're dealing with right now is developing a diagnostic test for gonorrhea, and hopefully that'll be something that'll be available for actual field use in the near future. This is just a quick slide to show an increasing trend, which is quite disturbing in terms of CPOs reported to the NML. And finally, in terms of outbreak support, we're always there to support our colleagues in the provinces and territories in terms of technical expertise, be it laboratory or epidemiological or otherwise. And finally, I guess in summary, I think it goes without saying that we really push for what we call a pan-Canadian approach, recognizing there's a wide range of stakeholders in multiple sectors. And just for the agency to focus, as I just mentioned previously, is to strengthen surveillance. We recognize that's one of the first or key activities that we need to work on in collaboration with all of you. KTE activities will continue forward with our public awareness campaigns, as well as guidance. And maybe the last one I'll focus on is the linkages and the coherence among our partners, certainly within the Canadian family, the federal family, but also reaching out to our international colleagues and friends as well. So with that, I will conclude my talk, and thank you very much for your attention.